Hi, everyone. My name is Mandy Peaks. I am a Community Prevention Project Coordinator with ESD 112, and I am currently working on a grant-funded project to prevent opioid misuse among youth. I sit on the Prevent team. If you are not familiar with Prevent, we are a community coalition that formed over 20 years ago now, and our goal is to increase collaboration and reduce youth substance use. And so we offer support and technical assistance all throughout Southwest Washington and also in rural communities throughout the state. So today we're going to be discussing a campaign called Friends for Life, which focuses on increasing awareness and education about the risks and harms of illicit fentanyl. And this training is really structured as a train the trainer model. And so my goal is for each of you to take this information and use it within the context of your role in working with youth. However, as we know, it's really important that as adults and as educators, we understand everything that we can about a topic before we go out and present the information to youth that we work with. And so I want to start by providing you with some education about opioid and illicit fentanyl prevention. And this may feel like review for some, and that's okay. My hope is that you'll leave today feeling a little bit more confident with this information and with a plan to use the lessons that you've learned within your professional role in a school setting. So here are our objectives and a little bit about what today will look like. I'm going to start by presenting information about Friends for Life, which is an evidence-based program. We will outline why opioids and fentanyl education are important, what resources are available to support you with implementation in your schools, where to find those resources, and then I'll actually do a demonstration of the classroom curriculum itself. Following that, we will take a deep dive into best practices for use of the Friends for Life campaign. And again, my hope is that you can take this knowledge and incorporate it into existing substance use classroom curriculum that you're already providing to students. So most of you are already teaching some sort of health education to students. And so I'm really hopeful that this will fit in seamlessly to what you're doing. And that way, if you're taking it and using it within your roles, it's sustainable long term, and kids will receive that knowledge year after year after year. So, why is this topic important? In Washington State and actually all over the United States, illicit fentanyl and other powerful additives are making drugs more unpredictable and more harmful. And in Washington, about 70% of overdose deaths involve fentanyl. And unfortunately, opioid-related overdose are increasing among younger populations. And this is due to widespread availability of illicit fentanyl, the creation of counterfeit pills that resemble prescription pills but actually contain illicit drugs, and the ease of purchasing pills through social media. In response to this and to combat the public health crisis that we're seeing around fentanyl, Washington State took action and the legislature passed House Bill 1956. And what House Bill 1956 did was it required the Office of Superintendent of Public Instruction, or OSPI, to disseminate instructional materials throughout the state and update the Washington K through 12 learning standards for health education to include opioid prevention education in middle and high school classrooms. So essentially, what they've done is they've made an amendment to an existing requirement. And since schools are already teaching about substance abuse in a variety of topic areas, it is now recommended to add opioid education into what's being shared with students and families. And again, that's because we're seeing an increase in the number of opioid and fentanyl related incidents in younger populations. So in the updated learning standards that went out to schools, Friends for Life is the recommended instructional support. Um, so if you have any questions about this, talk to your school first, and then I've got a couple of points of contact at OSPI on the screen as well. They're the same ones that are listed on the updated learning standards, and you're more than welcome to reach out to them if you have any questions about anything. What is Friends for Life? You may or may not have heard of it. Friends for Life is a campaign that was designed by a consultant hired through Washington State Healthcare Authority. It's all online and it's an evidence-based program, again, to increase awareness and education about illicit fentanyl specifically. And the name Friends for Life has a lot of meaning to it. So when they selected this name for the campaign, it's because it was inspired by young people's care for their friends and their instinct to keep one another safe. And the designers went through, they worked directly with youth to design this campaign, but they tested a few different concepts. And ultimately, they chose one that they felt led with empathy and avoided any sort of stigmatizing language and avoided scare tactics. There are four main goals for the Friends for Life campaign. The first is to define what opioids and illicit fentanyl are and how it's affecting Washington. The second is to explain how teenagers can avoid opioids like fentanyl. The third is to describe how to spot and respond to an opioid overdose. And the fourth is to share ways about accessing and using naloxone or Narcan. Now, this campaign has a ton of different parts. There are presentations, posters, social media content, parent brochures, student materials. There are multiple different presentations depending on the age group that you're working with. So there's a presentation for middle schoolers, high schoolers, and parents. Both of the student-focused presentations come with an interactive activity, and so you can have more of a hands-on approach to the education that's being provided. And I'll talk about that activity today. We won't actually do the activity together just because of time constraints and the fact that this is a virtual training. But this campaign is being used all over the state of Washington, and we would love for it to be in more schools here in the Southwest region. Let's dive into a demonstration of the Friends for Life curriculum. This is the middle school version. That's what the MS stands for. But the differences between the middle and high school versions are fairly subtle. There's some differences in the language that's used, the level of depth, and the activity varies. So if you teach a different age group than the demonstration you're watching, that is totally okay. Just make sure when you go to the Friends for Life website to download the age-appropriate materials for your community. And please know that when I actually lead this for students, I try to make it as interactive as possible. I ask a ton of questions that get them talking, brainstorming, working together at their tables. Sometimes I even give out prizes if they have a really great response to something. But since this is a demonstration and it's really focused on training for all of you, I'm going to tell you the questions that I typically ask, but obviously I don't expect an answer. But when you take this information and use it in the classroom, it's probably going to take a little bit longer than when I go through it because the students are interacting with you and are completing that activity, which takes about 15 to 20 minutes. So I'll put on my other hat now and I'm going to do a sample presentation. You may hear me jump back and forth a little bit to give you some tips. I'll try to change the intonation so you know when I'm presenting and when I'm giving a tip. Welcome, class. Today we are going to be talking about opioids, fentanyl, and fake prescription pills. But before we get started, I just want everybody in the room to raise your hand if there's someone in your life that you care about. The hope is that everybody will raise their hand. Maybe it's a friend, a family member, maybe it's yourself. I care about myself. And it's really important that we keep the people that we care about in our life safe, right? So we're going to be talking about a program called Friends for Life, and it's all about how you and your friends can be informed, stay safe, and avoid illicit fentanyl. This is an overview of everything that we're going to cover. We're going to walk through the basics about opioids and fentanyl, including how this issue is affecting people your age. We'll talk about what you and your friends need to know about avoiding illicit fentanyl altogether. And then we'll walk through some information about naloxone or Narcan, which is a medication that helps reverse an opioid overdose. Now, by a show of hands, how many of you have heard of opioids or think you might know what they do? This is where you'll field responses. You can prompt with some additional questions like, well, how many of you have heard of fentanyl? Where did you hear about it? What is it? And this just kind of gives you a sense of what students already know about the topic. Just to make sure that we all have the same facts, I want to briefly touch on the basics. So opioids are a type of drug used to manage and relieve pain, And they work by binding or attaching to nerve receptors in the brain, spinal cord, and other organs in the body. And as you can see on the screen up here, there are a couple of different versions of opioids. We have regulated or legal versions of opioids, and then we have unregulated or illicit versions of opioids. So regulated opioids are often prescribed following surgeries or injuries. They can also be a part of a cancer treatment plan. So these are drugs that you receive from a doctor to help you manage your pain. And unregulated or illicit versions of opioids are sold as street drugs. And there are several key differences between regulated and unregulated opioids, and that includes how they're made, where they're made, and who gives them out. And these measures are designed to help keep people safe. So regulated opioids are highly controlled. They're made in official labs, and that means that the amount of medicine in each individual pill is the same. And these are prescribed by medical professionals and are dispensed through pharmacies. So has anyone ever gone to pick up a prescription at a pharmacy? Maybe you got sick, or maybe you have an inhaler. Perhaps you've gone with your parents to get a prescription. Yeah, and so it's really important that when we get a prescription from our doctor that we follow their exact instructions. Unregulated or illicit opioids are uncontrolled. They are made in underground labs and they are sold illegally on the streets and on social media. And illicit fentanyl is considered an unregulated opioid. And a part of what makes it so harmful is that it's made in this uncontrolled environment where the strength of each pill or the strength of each batch of pills can be very different and impossible to predict. And so some pills may contain very little fentanyl, whereas others contain lethal doses. And there's not a way for us to tell them apart. There is no way to tell how much fentanyl is in something based on how it looks, how it smells, or how it tastes. So can someone tell me again, what's the main purpose of an opioid? Pain relief. So the main effect of any opioid is pain relief. However, there are also side effects associated with taking an opioid, and the main ones include sleepiness or becoming drowsy and slowed down breathing. And if someone were to take too much of an opioid, they could experience what's called an opioid overdose. Can anyone tell me what an opioid overdose is? An overdose means that a person has more opioids in their system than their body can handle, and that causes their breathing to slow down. And an overdose can come on very quickly. It can be life-threatening, and the overdosing person will appear to be sleeping, but they cannot wake up, even if you shake them, even if you yell at them, and without any sort of medical intervention, their breathing could stop altogether. If you were to encounter someone that was experiencing an overdose, or if you were with somebody who had an overdose, you may notice a few things. So aside from that slowed down breathing, some signs that a person has overdose could be that their skin turns blue, gray, or purple. Can anyone tell me why would somebody's skin turn blue, gray, or purple? This is because they're not getting enough oxygen. And they may appear pale, ashy. They may have cool skin if you were to touch them. You may also notice blue or ashy white lips or blue or purplish fingernails. And opioids can be habit forming or addictive, especially if they're misused, if they're taken in large doses, if they're taken too often, or if they're taken as a way to get high. Now let's talk specifically about fentanyl. Fentanyl is a powerful, fast-acting opioid that is much stronger than other opioids. Does anyone want to take a guess? How many times stronger is fentanyl than other opioids? So this is a great time to involve students because they like to make guesses about things and they're going to guess how many times stronger is in it. You might have to cover up the number on your slide so that you don't give it away, but let them guess and then tell them that yes, fentanyl is about 50 to 100 times stronger than other opioids. And there is a legal version of fentanyl. It's used in medical settings, which is highly regulated. And then there's an unregulated or illicit version of fentanyl, which we've been talking about today. And illicit fentanyl is sold illegally on the streets and on social media. It's usually in the form of a pill or a powder. So it can actually be pressed into pills that look just like real prescription pills, like Adderall or Xanax. And these pills are fake, but they're nearly impossible to tell apart from a real prescription pill because they're designed to look similar. Illicit fentanyl can also be mixed in as a powder into other types of illegal drugs. And as we talked about, fentanyl is very strong. So a really, really tiny amount can be enough to cause an overdose. It actually only takes about a 2 milligram dose. Can anybody tell me how much is 2 milligrams? Responses may vary a little bit here. I know some groups of students have been told that it's about the same size as the tip of your pencil. So that's a great analogy. I like to use salt grains. So if you were at home and you poured a little bit of salt in your hand, just a few small grains of salt is enough to cause an overdose. And as we talked about, fentanyl is really fast acting. So that means that overdoses can set in very quickly, and fentanyl can be lethal the first time that you use it. So this is what you need to know about how this issue is affecting people your age. In Washington, about 70% of overdose deaths involve fentanyl, and this is impacting people of all ages. And recently, we have seen more overdoses occurring among younger populations. Those who are encountering fentanyl often do so by accident because they didn't realize that a pill was fake. And so that's why it's important for us to be educated and aware. What I want you to know is that most teens are not actively seeking out or are knowingly experimenting with fentanyl. Can anyone guess what percentage of students are not experimenting with prescription pills or are using them as a way to get high? Again, students love guessing games, and they usually start guessing around 50% or so. Make sure you phrase it. This is the percent that's not experimenting. We want to normalize that most people aren't doing this. But I'll tell them higher, 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 and they keep guessing and guessing and guessing. And ultimately, we get them close to the correct answer. And recent data has showed us that 99% of teenagers do not use pills as a way to get high. So what can each of you do to help? The issues of illicit fentanyl and opioid overdoses are not affecting just every community in our state, but they're affecting communities all over the country. And this isn't a small problem by any means, but that doesn't mean that we are all powerless. Each and every one of you are powerful. You have a voice, and you absolutely can and should be a part of the solution. And so these are a couple of ways that you can take action. We're going to talk about the importance of not taking or sharing pills that weren't prescribed to you. We'll talk about refusal skills. We'll learn to recognize the difference between positive and negative peer pressure. And we'll learn to be a good friend to others. And keep in mind that every small action you take adds up to make a big difference, not just in your life, but in the lives of your friends and your loved ones too. Okay, let's talk about each of these in more detail. So illicit fentanyl can be in fake prescription pills that are designed to look like real ones. So it's very, very important to never take a pill from someone else and to not share your own pills that were prescribed by a physician. And the majority of young people who encounter fentanyl are doing so accidentally because they're mistaking these fake pills for real prescription pills. And they typically access these pills on social media, or it could be from a friend. And your friend may or may not know that the pills that they have obtained have fentanyl in them. So even if you trust your friend, it's important not to take a pill from them. One of the simplest and best ways that you can make sure you never come into contact with illicit fentanyl is to not take or share prescription pills that were not prescribed to you by a doctor. It's also important to understand and use refusal skills. Can anyone tell me what a refusal skill is? Students are pretty good about guessing this one. Usually they start shouting, it's a way to say no, or something along those lines. So yes, it's a way to say no. Refusal skills are practical and concrete ways that you can refuse offers to try pills or any other type of drug, or to altogether just avoid a situation where people may be using pills as a way to get high. And you might not feel comfortable using all of these, but what I want you to think about is choose one or two that might feel like something you could use if you ever found yourself in a situation where you were to need one. So let's walk through some examples. And I have found that this is a really, really good opportunity for engagement. Point to one of these, have students read what it is, and then ask them, what does that mean? And they can tell you what they think it is. And that works especially well for middle schoolers. So who can tell me what this first one in orange says? Make an excuse. What does that mean? This strategy could sound like, I have a test tomorrow, I have sports practice I can't miss, I've got family coming into town. Any sort of excuse to explain why you don't want to try what's being offered. Who can read me the yellow one? Avoid the situation. This is simply about not going places or hanging out with people who may be likely to try pills or any other type of drug. So it could mean declining an invitation to a party or just avoiding going to a certain person's house. Who can read me this pink one? Send a signal. So, what does that mean? Middle schoolers have all sorts of guesses about this one. They say like, oh, sending a gesture to your friend that you need help, whatever it may be. But really, this is about having a code that you can text or call your parent or caregiver or maybe an older sibling if you want them to come and pick you up right away. It could be a code word, a phrase, or an emoji. And middle schoolers get really excited about this one because they want to tell you what their code word for their parent is going to be. So I've even gone around the room and just said, like, what's everybody's code word going to be? And when are you going to talk to your parents about this? And they all come up with all sorts of crazy things. Who can read me the one in white? Pass the blame. This is one where I like to bring a personal story in because this is what my parents always told me. If you ever need to get out of a situation, you can blame me. So pass the blame to your parent. I would be totally grounded if my parent ever found out. Offer an alternative. This is another one that students, especially younger students, love to talk about because they really like to tell you what they like to do. So this is all about suggesting a different activity. What would you rather do? Maybe you want to go to the park, play a video game, take a walk, play a sport, practice an instrument. It could be anything. So get them involved on like what alternative would you suggest? What would you rather do? Who can read me this bottom one in blue? Be honest. At the end of the day, no is a complete sentence. Did you know that no is a complete sentence? It is totally okay to be honest and simply say that you do not want to try what's being offered. You don't owe anyone an explanation. But that being said, I recognize this one can be hard sometimes, but know that it does work. Who can read me this bottom one in orange? Be an advocate. What does that mean? We've been talking a lot about how this program is called Friends for Life, and your friends care what you think, and you have more influence than you know. So, if you are ever in a position to not only refuse drugs, but also take it a step further and share what you know about the risks of trying pills, that's something you absolutely should do. And every time that you stand up for yourself, you give other people the permission to do the same. So let's take about 2 minutes. I want you to turn to your neighbor, talk amongst your tables, and share which one of these refusal skills you'd be most likely to use and why. And it's up to you, depending on time, depending on what type of group you have. If it's a chatty group, you could have them share out. Every once in a while, I'll go around the room and ask, like, which one did you choose? Which refusal skill would you be most likely to use? And they get kind of excited about sharing. I've been pleasantly surprised that a lot of students end up saying that they would pick be honest out of everything. So that's pretty cool. Now, every healthy, supportive friendship, relationship, or connection that we have helps to protect us. And it lowers the risk that we'll ever experiment with pills or any other types of drugs. And when you truly show up for your friends, you can help to protect them too. So I want to talk a little bit about peer pressure. Can anyone tell me what peer pressure is? And middle school students typically respond and say, it's when someone forces you to do something, or it's when somebody keeps pestering you over and over and over and over again until you cave and do what they want. And so that kind of leads perfectly into this conversation, in that you'll share with them, peer pressure always has this reputation of being a bad thing, but that's not always the case. Positive peer pressure can motivate you to grow, to try new things, and discover things about yourself. And so, learning the difference between positive and negative peer pressure can help you to understand who you might want to spend more time with. So, can anyone in the room think of an example of when your friend encouraged you to do something positive? Students will give you all sorts of examples. You'll always have a couple that pull in things their parents brought up, like, oh, well, my parent encouraged me to do the laundry. They've got all sorts of stories. But some examples that you could share are, I convinced a friend to study and they got a better grade. That's a very positive thing. Or I encouraged a friend to apply for an after-school job or try an after-school activity or a sport. There are lots of great examples. And friends should not be encouraging you to do something that could hurt you. Can you think of an example of negative peer pressure? And I'm a little cautious about how they word that question. Notice how I didn't ask about how their friends negatively peer pressured them. I just asked in general, what's an example? What would that look like? And so students will give some examples. If you need to prompt them, you can share some of the examples on the screen here. I convinced someone to skip class or school. I encouraged bullying or gossip of another classmate, which would hurt their feelings. Or I pushed someone to take an unsafe risk, like drinking or taking drugs that could cause real harm. So, how can you tell the difference between positive and negative peer pressure? And students' responses will differ at this point, but the goal is to really help them understand that positive and negative peer pressure feel different to them. So, negative peer pressure could feel bad, it could make them worried or anxious, it might feel like it conflicts with their values, whereas positive peer pressure may motivate them to learn or grow, or it may invigorate them. And the friends that we make right now, they influence our choices and they influence our future. And it's totally possible that your friendships will last you a lifetime. Friends are great because they give us this sense of belonging. They help us to learn to care for one another, to respect and communicate with other people. And so it's really, really important to reflect on the qualities that you want in a friend, what values are important to share, and how you expect to be treated in a healthy friendship. So there are some things that you can ask yourself when you're meeting new people and forming friendships. And some of those questions could be, does this person seem to really care about me? Does this person respect me? Is this person being open and honest with me? Does this person share or support my goals and my values? Are there any other questions that you might ask yourself to help you know if someone's being a good friend to you? Now we are going to move into an activity. So I'm not actually going to do this activity, but what I'm going to do is I'll walk through and explain what it is when we get to the list of Friends for Life resources. There's a full lesson plan that's available for you to download and use. It walks you through this step by step. But the goal of the middle school activity is to help students recognize common risk factors for drug use, including the misuse of pills. And so students will work together to talk about this, and then they'll also identify protective factors to prevent drug use. And this concept of both risk and protective factors is really foundational to decision making of all kinds. And so it may be the first time that some of these younger students in middle school are hearing about this, but it helps them to understand, why would someone their age try to seek out pills and come across a fake pill that may have fentanyl in it? And it also introduces the idea that friendship can be protective and you can actually have a direct impact on your friend's safety. So the hope is that by the end of this activity and by the end of the session, students will feel really empowered to protect one another. Okay, so at this time, you'd pass out the worksheet, and it starts by asking at the top for students to start brainstorming what the phrase risk factor might mean and to work to define it. And so you'll give them a few minutes to kind of talk about that amongst themselves, ask if anybody wants to share. And then to support them in understanding what it is, you can use some examples, such as a car accident or receiving a low score on a test. So when we think about a car accident, what are some risk factors that would increase the likelihood of getting in a car accident? And they may come up with, driving too fast, texting and driving, drinking and driving. And then you can ask, well, what are some risk factors that could increase the likelihood of getting a low test on a score? And they may come up with, not studying enough or looking at your neighbors, not listening in class, all sorts of different things. So helping them to kind of think through, what does that mean? What is a risk factor? And then you can share the definition, which is a behavior or condition such as smoking or high blood pressure that increases the possibility of sickness or injury. Then you'll break back into groups and you'll ask students to brainstorm the top 3 most common risk factors for why teens would experiment with drugs like prescription pills. So you can have somebody in the class just read this description. It says fake prescription pills laced with fentanyl, meaning fentanyl has been pressed into the pills like we talked about. That is the most common reason that teenagers overdose on opioids. There are 3 common risk factors to explain why young people might seek out pills in the first place. What do you think those risk factors might be? I'll give the group, 5 to 10 minutes to brainstorm amongst each other. If you have any sort of giveaways or prizes, this is a great time to pull those out and see if anybody could come up with what the 3 risk factors are. So before you display the next slide, you can ask, what did you come up with? For all of the guesses, you can display this slide and explain those top 3 risk factors and what they mean. So one part about being a good friend is recognizing when someone might be struggling or might be at greater risk for experimenting with pills. And the 3 most common risk factors are mental health challenges like stress, anxiety, or depression. So if someone were to be experiencing emotional pain, they may take pills to try and make that pain go away. They're also more likely to use alone, which can be dangerous. Physical pain, so anyone who has been injured or is experiencing some sort of physical pain, they may try pills to help with that pain. So it's really important if you do have an injury to make sure that you talk to your parents or caregiver and go see the doctor to get that figured out. And social pressure. Teens may experiment in social settings where other peers are drinking, taking pills, or using other drugs. If you have a friend that isn't acting like their usual self, you should try talking to them. Learn how you can be there for them, learn how you can support them, and if the problem seems really serious, you should talk to a trusted adult too. Now, for every risk factor, there are also protective factors. So you can ask students to brainstorm what is a protective factor. And after they've given it some thought, you can display the definition, which is a skill, strength, resource, support, or coping strategy that helps people deal with stressful events and lowers the risk of sickness or injury. So risk factors increase the likelihood of sickness or injury, and protective factors lower the likelihood of sickness or injury. So that's how you can help them understand the difference. And then there is a portion of this worksheet that has students break back into groups and work together to brainstorm protective factors that could counteract the risk factors of mental health challenges, physical pain, and social pressure. And so you can ask them to share some of the responses they may come up with are having good friends, going to see the counselor, being able to go to the doctor, joining an activity, parents, pets, a variety of different things. And so just brainstorming what are things in their life that help them to cope with stressful events. Another 5 minutes or so to complete this portion of the activity. And then finally, you'll wrap up with a couple of reflection questions. So it's up to you, depending on what kind of time you have. You can have them respond on their own to these questions. You can have them respond and share. You can have them choose one, or just say, take this worksheet home and I want you to reflect on what we've talked about today and respond to some of these questions on your own. Lastly, I want to talk about naloxone, which is also known by the brand name Narcan. It is a medication that reverses opioid overdoses, and it's available in two different forms. It's available most commonly as a nasal spray, but there's also an injectable version. And naloxone is very simple. It's safe to use. It is available to buy without a prescription, so you can get it over the counter at stores like CVS and Walgreens. And what it does is it reverses opioid overdoses. And in Washington, we have laws called Good Samaritan laws, which protect people who call 911 in the event of an overdose emergency from getting into any sort of legal trouble. And so if you are with someone who you believe has overdosed, you should always call 911. That should be the very, very first thing that you do. And then if you have naloxone or Narcan on hand, that's something that you can administer to try and help them while you wait for medical attention to arrive. So how does it work? Our brains have opioid receptors like we talked about. So naloxone is a type of medication called an opioid antagonist. And what that means is it blocks opioids from binding or attaching to the receptors in our brain. So if someone is overdosing on opioids, naloxone will help to reverse the effects and then help them to wake up and start breathing again. But depending on how much of an opioid was taken or how much fentanyl was in something, naloxone may only wake them up temporarily. And so multiple doses may be needed. And the most important thing is that 911 has been called so that person can receive medical attention right away and go to the hospital. Naloxone does not have an effect on someone who is not using opioids, meaning that if you give it to someone and they're not overdosing, you can't hurt them. It's also not going to work to treat the effects of other types of drugs or alcohol. And it's not habit forming. There aren't any side effects. So this is the most effective tool that we have to save lives in the event of an overdose emergency. So at this time, I'm going to walk through the website and show all of the tools that are available and just kind of give you a little tour. We might have some funding available to order print materials, and so we'll do our best to accommodate and support people in the region that Prevent and ESD 112 serves. So you're welcome to reach out to me to see if we have any resources available or if we have a budget to get some print materials. But this is the website, wafriendsforlife.com. It's a really fantastic website. There's some videos that you can watch. It kind of gives an overview of everything that's on this page. So there are resources about starting the conversation in general, whether it's parents, caregivers, or any trusted adult in a young person's life who can talk to them about opioids and fentanyl. There's a whole section on overdose prevention. You'll notice that the curriculum itself doesn't take a deep dive into overdoses. It explains what it is and what naloxone is, but it doesn't actually walk through like the process of administering. So there are some videos if you want to take a deeper dive into that. There's a section on how to get naloxone, and then there are some toolkits, which I'm going to walk through. This is really what I've just talked about today. This is like what the campaign is. But over here on the right, there's toolkits for parents and caregivers, prevention partners, and harm reduction partners. This prevention partners is the one that you're going to want. And you'll notice right here, if we aren't able to provide materials, you can also order some through the developers of this campaign. So you can reach out to Devin. These are all jump links if you want to skip to a certain section. There are some culturally specific materials that were created and informed by Native people in Washington. So you can look at For Our Lives or Healing of the Canoe Project. And then right here is all of the print and digital resources, social media posts, brochures. This teen conversation guide over here in white is really nice because you can just print it from a regular printer and it prints out on white paper. There are middle and high school posters, some youth postcards, wallet cards. They also have pens, buttons, stickers, some different handouts that you can provide. And then down here are the presentations and activities. So there is a presentation for parents and guardians. It's in English and Spanish. Then there's the middle school presentation and activity and the high school presentation and activity. There is a script included in the PowerPoint presentation, and you can tailor it any way that you'd like. I've kind of expanded on a few different things for my talking points, but that can give you a starting point to use for your classroom. And then more videos if there's anything that you want to play in your classroom. And then under this overdose prevention, there's also a facts and FAQ. And so if you feel more confident preparing for any questions that students may ask you, here's an FAQ section that kind of walks through, can you overdose by touching fentanyl? And um, who can use naloxone? Where can you get it? There's all sorts of questions. So that's a really good section. Best practices. So lastly, I just want to explain how you might use this in your school. The most important thing is to share these materials and share them broadly. So put up posters in your school, give out stickers and buttons to the students, distribute resources in the classroom and to parents. If you've got any sort of events or school-related communications, send this home to families because it's really important that it's not just educators talking about this with youth, but parents are as well. And then aside from sharing the materials, present this information to students. I just mentioned that the presentations come with a script, but it's meant to be a really flexible program. And so you can customize the content to meet the needs of your student population. Of course, be sure to stick to the facts, but feel free to expand upon information or modify the content based on your school's preferences and culture. And the way that I presented it includes everything that was approved by the Friends for Life developers, but do what works best for your school. As far as how to present this, it's totally up to you. Like we talked about at the beginning, the best practice is to incorporate this into existing education that's already being provided. So SAPs and PIs, you can include this in your prevention education series. Some of you have shared that you don't have time for a full hour-long session on opioids and fentanyl. And so maybe you took a portion that you felt like your student population needed a little bit more information on, and you plugged that into some slides where you were talking about tobacco, cannabis, and alcohol already. Or maybe you do have the full hour and you can give the entire Friends for Life curriculum. That's totally up to you. Health education or PE instructors, if you could incorporate this into your existing substance abuse education, that would be great. Same type of thing. If you have time to do the full hour, that's fantastic. If you're feeling pressed for time because you're already teaching about so many different topics and you're doing such a wonderful job, you can pick and pull information that seems most relevant. If your students have already had a ton of education about refusal skills. Maybe you don't need to talk about that again and you want to focus in on that positive and negative peer pressure, or maybe you just want to explain what opioids and fentanyl are. Do what's best for you. That's why this is so flexible. Okay, that's all we have today. Thank you so much for being here. Thanks for all you do to help prevent substance misuse among youth in our area. We couldn't do it without you. And if you have any questions, you're welcome to reach out to me. Again, my name is Mandy Feeks. I'm at ESD 112 on the Brent team. Thank you.